Today, we're going to be talking about the heart and all the structures and functions of the heart that you're going to need to know for your upcoming lab exam. But before we get started, I do want to add some clarification that if I say anything that is or isn't on your objectives, please clarify it with your professor or come into the lab for further assistance. And with that, let's get on to the video. Something that I think is important to note before we get started in this video is to mention that any of these three models could be seen on your lab exam, and so it's important to know the structures on each individual one. But for sake of this video, I'm going to be primarily using this heart in the middle. Alright, so before we get started, there's a couple terms we need to go over, namely chamber, vessel, structure, and layer. Additionally, we are going to want to note symmetry, so indicating left and right where applicable. To start us off, let's talk about chambers. So let's open up the heart to see what we're talking about. With the heart open, let's find our chambers. We have our right atrium, our left atrium, our right ventricle, and our left ventricle. Those are the four chambers of the heart. And how I know those chambers are right and left is based on the thickness of this muscle right here. The muscle is much thinner on the right side because this blood is only being pumped to the lungs, whereas the muscle on this side is much thicker because it's being pumped to the entire body. So those are the chambers of the heart. Now, we can also ask a question about the chambers of the heart with it closed like this. If I were still pointing here and asking you for a chamber, you would have to say right ventricle. Because I'm asking for chamber, not layer, not structure, that's the only thing it could be, even with the heart closed like this. Moving on, let's talk about some other structures. These up here are called auricles. We have our right auricle and our left auricle. Something else that's here on the heart that really jumps out to me is this right here. This is the apex, where the heart comes to a point. And moving on, let's go and talk about the layers of the heart, starting with the parietal pericardium, the most superficial layer. Now, this layer isn't really depicted on this model, as it would be kind of like a sac surrounding the entire heart, filled with that pericardial fluid, so it's not really shown in this model, but just know that it surrounds the heart. Next, let's talk about the epicardium, or the visceral pericardium. So if I have my pointer here on the heart, and I'm asking you for a layer specifically, you would say the epicardium, or the visceral pericardium. That's the layer that comes in physical contact with the outside of the organ, and that's not attached to the organ wall or anything like that, particularly on the organ itself. Next, we have the myocardium. To see that, let's go ahead and take a look inside the heart. The myocardium is this layer right here. Again, keyword layer. If I'm pointing here and asking for a structure, that will be something different. Next, let's talk endocardium. Endocardium is this layer right here. Again, if I was asking for structure and pointing here, that would be something different. Even if I was asking for chamber and pointing here, that would be something different as well. So if I'm asking for layer, that's going to be our endocardium. If I'm asking for a chamber, we talked about this briefly earlier, this would be our left ventricle. And if I was talking structure and pointing here, that will be something different that we'll get to later. Let's go ahead and pop the top of the heart back on. Moving on, let's talk about the coronary sulcus. So to see this, we have to kind of turn the heart a bit upside down. So when we're looking at the heart like this, we can see our coronary sulcus is going to be underneath the structures right here. We'll talk about these in a second. To find our anterior interventricular sulcus, we're going to look at the front side of the heart. To give some directional terms, this is going to be the anterior side of the heart. This is going to be the posterior side of the heart. And with that, let's continue. So our anterior interventricular sulcus is going to be here, where these veins and vessels kind of fall in. We can see the heart has a bit of a dip. That's going to be that sulcus right there. And notice how it says anterior interventricular. Interventricular meaning between the ventricles. So anterior, between the ventricles, sulcus. With a lot of the terms of the heart, it's going to tell you exactly where it is on the model if we pay attention to the name. So again, anterior interventricular sulcus. Now for this next one, it's posterior interventricular sulcus. So we know we have to go to the posterior side of the heart. Between the ventricles, we find this sulcus right here. And again, we're not talking about the vasculature. We're talking about this little divot right here on the back. Moving on, let's go ahead and open the heart again. Here, we're going to take a look at some of the septums of the heart. To begin, we're going to have the interventricular septum. Now, if you remember, we did the interventricular sulcus earlier, and we knew that was between the ventricles. So interventricular septum, the septum between the ventricles. Same logic applies for the interatrial septum. If these are our two atria, the septum is going to be in between those two. Next, let's talk about some of the valves. Now, there are some different names for these valves, so I'm going to run through the ones that I'm aware of that your professors might have you use. To begin, on this right side, we have this valve right here, known as the tricuspid valve or the right atrioventricular valve. On this side over here, we have this valve, which can be known as the bicuspid, mitral, or left atrioventricular valve. Make sure and ask your professor which term they prefer you use. Next, if we turn the model like this is going to be the pulmonary semilunar valve. Moving on over here, and a bit underneath, this is going to be the aortic semilunar valve. Let's go ahead and set it back down. Next, let's talk about some of the musculature of the heart. Starting up top, these are going to be our pectinate muscles. Moving down, we have our trabeculae carneae, the muscles in the ventricles. Next, we're going to have our papillary muscles. Those are the muscles that come down and attach to these right here. They're a lot thicker. Those are going to be our papillary muscles. Moving on, we also have this structure right here. This is the fossa ovalis. It closes after birth. Another feature that closes after birth is this right here, the ligamentum arteriosum. Next, we have these structures right here. These are going to be our chordae tendineae. They're what anchor to the papillary muscles right here. Let's go and put the heart back together. All right, so to start us off with some of the major arteries and veins, let's talk about this right here. This is the pulmonary trunk. It leads off into, if we turn ourselves around, we have the right and left pulmonary arteries. Now, this might be a bit confusing because it's colored blue, when traditionally arteries are colored red. However, this blue color is meant to indicate blood that is low in oxygen. And it's an artery because A for away, the blood is leaving the heart and entering the lungs. When the blood is coming back, that's always going to be a vein. So these are going to be our left and right pulmonary veins. Turning ourselves a little bit to the side, let's take a look at our aorta right here. We have a couple different parts to the aorta. We have the ascending aorta, we have the aortic arch, and we have the descending aorta. Now the descending aorta can be in the thoracic region, where the rib cage is, where the lungs are, and everything like that, or it can also descend lower into the abdominal region, and that's where it becomes the abdominal aorta, everything under the diaphragm. Now we can see that the aorta branches off. Let's talk about those for a second. We have our brachiocephalic trunk, our left common carotid artery, and the left subclavian artery. A friend of mine taught me the A, B, C, S, because it's as easy as the ABCs. We have our aorta, our brachiocephalic trunk, our left common carotid artery, and the left subclavian artery. And that's how I remembered them. Next, let's go ahead and talk about some other smaller structures of the heart. Let's go ahead and open it up. To begin, let's take a look right here. See this? It is on either side of the aorta. The heart gets its blood supply first, and so that's why we have these small little branches right here on the heart. They're called coronary arteries. Specifically, we have a right and left coronary artery. Sometimes you see those abbreviated as RCA for right coronary artery or LCA for left coronary artery. Make sure and ask your professor if they are okay with the abbreviated version. So let's go ahead and put this back together and talk about it more in depth. To begin, let's talk about the right coronary artery on this side of the heart. First, we're going to have the marginal branch of the RCA. Again, right coronary artery. Now, if we think about the heart, there's a couple terms to note. First, we have the margins of the heart, the sides of the heart. Next, we have the circumference of the heart, all the way around. And again, we have the anterior and posterior side of the heart. All of those terms are going to come in handy when we're trying to identify these vessels. So to start us off, let's find the marginal branch of the right coronary artery. We know we're going to be looking to this side of the heart. It's the right side of the heart, and we're looking along the margins. We can see that this right here is going to be the marginal branch of the right coronary artery. Moving on, we have the posterior interventricular branch of the right coronary artery. Now we've already identified the posterior interventricular sulcus, so let's follow the right coronary artery. We can see it right here. If we follow it, this is going to be the posterior interventricular branch of the RCA. Moving on, we have the left coronary artery. We already identified it earlier over here. So let's go and find its branches. To start us off, we have the anterior interventricular branch of the left coronary artery. We're also going to have the circumflex branch of the left coronary artery. So we know that's going to be around the circumference of the heart right here. We're also going to see a marginal branch of the left coronary artery as well. We're also going to see this right here, which is going to be our left marginal vein. Back to talking about some bigger structures, let's talk about the vena cava. This is our superior vena cava, and this is going to be our inferior vena cava. Additionally, we're going to have our posterior interventricular or middle cardiac vein. And so our posterior interventricular vein is going to be this right here. Again, it is also called the middle cardiac vein. We're also going to have our great cardiac vein, which is going to be this right here. Next, we're going to have our coronary sinus. That's going to be back here, which is on top of the coronary sulcus. And with that, that covers the structures of the heart. Alright, so that is going to be it for this video. Thank you so much for watching. And of course, if you have any questions, please feel free to reach out. But don't forget to use your resources, and good luck on your upcoming lab exam.